brain cancer and brain tumor. A brain tumor is a mass or growth of abnormal cells in your brain. There are many types of brain tumors. Some brain tumors are noncancerous and some are cancerous. Brain tumors can begin in your brain, or cancer can begin in other parts of your body and spread to your brain as secondary brain tumors. How fast a brain tumor grows can vary greatly. The growth rate as well as the location of a brain tumor determines how it will affect the function of your nervous system. Symptoms: headaches that gradually become more frequent and more severe, unexplained nausea or vomiting, vision problems such as blurred vision and double vision, gradual loss of sensation or movement in an arm or leg, difficulty with balance, feeling very tired, personality or behavior changes. Causes: brain tumors that begin in the brain. Primary brain tumor originate in the brain itself or in tissues close to it, like in the brain covering membranes called cranial nerves, pituitary gland or pineal gland. Primary brain tumors begin when normal cells develop changes, also called mutations, in their DNA. A cell's DNA contains the instructions that tell a cell what to do. The mutations tell the cells to grow and divide rapidly and to continue living when healthy cells would die. The result is a mass of abnormal cells which forms a tumor. Primary brain tumors are much less common in adults than are secondary brain tumors, in which cancer begins elsewhere and spreads to the brain. Different types of primary brain tumors: gliomas. These tumors begin in the brain or spinal cord and include astrocytomas, ependymomas, glioblastomas, oligostrocytomas and oligodendrogliomas. Meningiomas. A meningioma is a tumor that arises from the membranes that surround your brain and spinal cord. Most meningiomas are noncancerous. Acoustic neuromas. These are benign tumors that develop on the nerves that control balance and hearing, leading from your inner ear to your brain. Pituitary adenomas. These are tumors that develop in the pituitary gland at the base of the brain. These tumors can affect the pituitary hormones with effects throughout the body. Medulloblastomas. These cancerous brain tumors are most common in children, though they can occur at any age. A medulloblastoma starts in the lower back part of the brain and tends to spread through the spinal fluid. Germ cell tumors. Germ cell tumors may develop during childhood, where the testicles or ovaries will form. The germ cell tumors may also affect other parts of the body like the brain. Craniofaryngiomas. These rare tumors start near the brain's pituitary gland, which secretes hormones that control many body functions. As the craniofaryngioma slowly grows, it can affect the pituitary gland and other structures near the brain. Cancer that begins elsewhere and spreads to the brain. Secondary or metastatic brain tumors are tumors that result from cancer that starts elsewhere in your body and then spreads to your brain. Secondary brain tumors most often occur in people who have a history of cancer. In adults, secondary brain tumors are far more common than are primary brain tumors. Any cancer can spread to the brain, but common types include breast cancer. Any cancer can spread to the brain, but common types include breast cancer, colon cancer, kidney cancer, lung cancer, melanoma. Diagnosis: if suspected that you have a brain tumor, your doctor may recommend a number of tests and procedures, including a neurological examination. This includes checking your vision, hearing, balance, coordination, strength and reflexes. Difficulty in one or more areas may provide clues about the part of your brain that could be affected by a brain tumor. Magnetic tests. Magnetic resonance imaging (MRI) is used to help diagnose brain tumors. Biopsy. Biopsy can be performed as part of an operation to remove the brain tumor. A biopsy sample is collected, then viewed under a microscope to determine if it's cancerous or benign. Treatment. Treatment for a brain tumor depends on the type, size and location of the tumor, your overall health and your preferences. Surgery. If the brain tumor is located in a place that makes it accessible for an operation, the surgeons will work to remove as much of the brain tumor as can be done safely. Some brain tumors are small and easy to separate from the surrounding brain tissue, which makes complete surgical removal possible. Other brain tumors can't be separated from surrounding tissue or are located near sensitive areas in your brain, making surgery risky. In these situations, your doctor removes as much of the tumor as is safe. Even removing a portion of the brain tumor may help reduce your signs and symptoms. There are risks associated with surgery to remove a brain tumor. These include infection and bleeding. Surgery on a tumor near nerves that connect to your eyes may carry a risk of vision loss. Radiation therapy. Radiation therapy uses high-energy beams such as X-rays or protons to kill tumor cells. Side effects of radiation therapy include fatigue, headaches, memory loss, scalp irritation and hair loss. Radiosurgery. This uses multiple beams of radiation to give highly focused form of radiation treatment to kill the tumor cells in a very small area. Chemotherapy. Chemotherapy uses drugs to kill tumor cells. They can be taken orally in pill form or injected into the vein. Chemotherapy side effects include nausea, vomiting and hair loss. Rehabilitation after treatment. Brain tumors may develop in parts of the brain that control motor skills, speech, vision and thinking. It may be necessary to undergo rehabilitation as part of recovery. Your doctor may refer you to physical therapy to help you regain lost motor skills or muscle strength. Occupational therapy to help you get back to your normal daily activities. Speech therapy to help you overcome difficulty in speaking. Tutoring for school-age children to help kids cope with changes in their memory and thinking.